So the research article I'm going to be speaking about is entitled A Protocol for Assessment of Risk in Wheelchair Driving Within a Healthcare Facility. It was written by Mendoza, Pittenger, Savage, and Weinstein. The purpose of their research article was to describe how a skilled nursing facility with significant wheelchair traffic developed a protocol for the multidisciplinary assessment and intervention management of patients who use said wheelchairs and how it represents a risk to themselves and to others. The staff at the facility developed this protocol for responding to observed events related to patients hurting themselves and others while using their wheelchairs. The goal was to determine the cause of the event, identify the necessary multidisciplinary interventions, and then evaluate the effectiveness of their interventions. The results were that case study analysis of the interventions indicated that a multidisciplinary evaluation and treatment plan led to correct treatment interventions that suited the patient's medical conditions while affording the patient the greatest amount of independence. In conclusion, they stated that in order to maintain client independence who live in a long-term skilled nursing facility, they must use either a manual or power wheelchair for mobility, and that this new protocol helps staff respond to important changes to the patient's condition and prepare a coordinated intervention when needed. The patients also found that the protocol was helpful in their treatment process. During this, the dependent variable were the skills of using wheelchairs prior to the interventions in which the patient were showcasing in the observations. The independent variable was the change seen in patients due to the intervention protocol of observations and preventions. Staff members were used as observers of the study as well as the patients themselves. They were both used to get feedback during questionnaires. And it was agreed upon that the protocol helped patients have less accidents and injuries when using these wheelchairs. The limitation surrounding this research is that the protocol that they found most helpful actually created limitations around the amount of time that patients use their wheelchairs, which did hinder some of their independence.